I'm here with Beth Robertson, our Associate Director for Learner Support Services, and we're here today to talk to you about a topic that is swirling around our community as we prepare to return to school. We have a lot of questions coming our way, and rightfully so, about what we're going to do if we get positive test results of COVID-19 among our employees, among our learners, or really among others that are in our schools. So what we did was we drafted a series of questions and answers, and we've placed them on our frequently asked questions page of our Return to School webpage. But we're also going to go over those questions and answers with you here today. So Beth, let me start out by just asking the big question. What do we do if a student or staff member tests positive for COVID-19?
Well, that is the important question. And first of all, I want to commend and speak to how fortunate we are to have such a highly trained and comprehensive team of registered nurses in each of our schools. So each of our registered nurses have been trained as contact tracers for the COVID-19 procedures with pandemic. What that means is upon any indication of an affirmative case, they will immediately begin contact tracing protocols. That will involve not only working with school staff to identify who may have been a close contact with a student in the school premises, but also being in touch with the family of the child, if it were a child, to find out what might have happened outside of school hours in terms of close contacts. If it were to be a staff member, we would follow those same procedures, working with that staff member to identify in the school building who they may have had close contact with and who they might have had close contact with in the community.
Okay, so let's say an individual does test positive, and maybe I should better phrase that, Beth, as saying when an individual tests positive, because we understand that that is going to happen. How will parents, employees, and even the community at large be informed about this?
Well, our Bedford County Public School webpage is going to provide some daily update information. That daily update will include the number of positive cases of students or employees that may have had an affirmative finding, and that's going to start the first day of our school year, September 8th, 2020. That will continue every subsequent day on that Bedford County webpage. And now, please understand, we certainly won't disclose any personal information for any individual. We are talking about protected health information. So that webpage document will certainly include the number of cases, the location or school setting where those cases have occurred, and the date. But other than that, the information will remain private to the individuals.
Okay, so it sounds to me, Beth, like what we're trying to do is balance the need to keep this information private for the individuals that did test positive, as the law compels us to do, but also recognize that in this moment, a lot of people are concerned, especially those who work in our schools or send their children to our schools. So I'm really glad to hear that. Now, let's talk about something else that's related to this. Let's say we don't have a positive test, but let's say we have students or staff that are at school and they are determined to have a fever or maybe even some other potential symptoms of COVID-19. What are we doing with that?
Again, it's a great question, and it's something that our nursing team, under the leadership of Mrs. Knox, we're prepared for that. The team of school nurses have developed a protocol for actually monitoring any presentation of symptoms. That protocol not only includes the nature of the symptoms, but it asks specific questions about close contact or potential exposure with students. So we're balancing that information of what is the symptom and is there the potential that this student may have been exposed or had any contact. So in balancing that information, the nurses would be able to make an assessment of what next steps are taken. I will certainly say that any student that are presenting with symptoms that could be consistent with COVID-19 will be designated into our sick room or isolation room so that that student is not encountering others that may visit the clinic for more routine reasons. A staff member that was presenting with similar symptoms would be dismissed from the school site for the day so that further monitoring could continue outside of the schoolhouse. We do ask that if students have been identified as having those suspect symptoms and are placed in our isolation room out of that suspicion, we ask that parents work with us to pick students up quickly to make sure that we're minimizing any risk of exposure. The one thing that I do want to say is students will be sick. Not all students that will present with symptoms in the clinic are students that are presenting with symptoms consistent with a COVID-19 presentation. So we're going to rely on the expertise of our trained and skilled nurses to make sure that we're doing a thorough diagnostic workup for symptom monitoring, but also just knowledge of the student, what their baseline may be, and what their needs are going to be in terms of making a decision.
Okay, thank you, Beth, for that. Now, a related question that a lot of people are asking. So we're talking about positive cases in the schools, perhaps in the community, and folks are asking, under what conditions would the school district suspend our in-person and blended learning options?
Well, that's going to be a complex decision. There is no one single formula for that. And I know that may seem frustrating for individuals in the community or families within the schools, but we really can't answer that with one single answer. When we're making that decision to suspend learning, we're going to be looking at any variety of factors. Number one, that level of transmission within the community surrounding the school and within school. We're going to look at the number of cases that we have specifically on hand, students or employees, and the information that we have about what that transmission may have been, a community transmission or otherwise. We're also going to rely on our public health officials. These are things that, that Virginia Department of Health and our health officials, they're dealing with on a daily basis in terms of making advisements. So any consultation about a response for suspending learning would be in consultation with our health officials and considering all those factors I mentioned.
Well, that seems reasonable. And again, to your point, maybe not as black and white as some folks would like it to be, but I'm glad that we are using the expertise we have within our own ranks, as well as what the health department is able to offer us with their expertise and unique perspective. So with that, a follow-up question, do you anticipate that there would be situations where we have some individuals, whether those are our learners or our employees, would be quarantined away from school while others could still be present for some in-person or blended learning options?
I do. And I think that's one important factor in the way Bedford County Public Schools decided to reopen that I want our families to consider. We spent a lot of hours deliberating how to ensure face-to-face opportunities for students that were as safe as we could possibly be. And that really came with that element of controlled grouping that we have across our K-12 learning campuses. We have students who are reporting to campus each day for face-to-face opportunities and opportunities for peer interaction, but in a very controlled manner. We are not mixing younger groupings of students. We are not allowing them to share common spaces without cleaning in between those situations. With our older students, even though there may be some increased movement to access course content, we are working diligently to minimize the number of students that would be moving in a building at any number of times. And we're also identifying that movement through digital tracking so we can easily record attendance and where students may have been at different points in the day. All of that work to create those small cohorts was to enable us to maximize the learning opportunities for students when we can. So, going back to what I said earlier about contact tracing, if we have a positive or affirmative COVID case with a student or a staff member, the extent of that contact tracing and determinations of close contact, less than 6 feet of distance for more than 15 minutes, when we have an identification of close contacts, or when those close contacts may not be able to be firmly established. For example, if a group of students may have been out on playground equipment. Those are questions that we're going to answer as we're making decisions about cohorts. Then when we look at that cohort of students, we'll make decisions about larger portions of that school campus. So we may have situations where students are on campus and continuing to access their learning, even if there has been a positive case in another section of the building or within another cohort. If there were no close contact, we certainly don't want to limit students' opportunities to access the campus.
Well, I really appreciate that explanation, Beth, because I think it kind of highlights our district's commitment to bringing our learners back to school and making life as normal as possible, which I know is what they want and their families want and our teachers want. Now, going back to a previous question, we talked about students or staff who may be exhibiting symptoms and maybe going home for a while. Is there any requirement that they have to go out and get a COVID test and show a negative test to return to school or to work in the case of an employee?
No. In fact, CDC and VDH do not recommend that all individuals who may have symptoms automatically go and receive a test. We're also not recommending that we have to have a negative finding. Some individuals may just need to be at home under self-isolation or quarantine and rest to recover. So no, students don't have to show a negative COVID reading before they can return if they have been out with illness. Now, one of the things that will be part of that nursing consultation, if the student has had symptoms that are possibly suspect of COVID-19, and if there's any potential that the student has had close contact or potential exposure with another individual, the nurse would work with the family to advise a longer quarantine or isolation period than typical. As I said, that quarantine period for a student who's had a potential exposure is going to be very different than a student who may just be sick with normal seasonal illness. So when we have a student who has a COVID exposure, potentially, and the presence of possible symptoms, we're going to be expecting at least 10 days of isolation since the onset of symptoms, that the individual will have been fever-free for 24 hours without medication, and of course, see a general improvement in symptoms overall. That's the requirement there. As with all of our other student illnesses that present to the clinic, if we're not seeing the risk of potential COVID-19 symptoms or any combined risk with exposure, those students who have presenting symptoms of illness would be able to return to school within 24 hours as long as they're fever-free without fever-reducing medication.
Okay, well, that's great. So it sounds like a lot of communication with our school nurses, between families and also with employees to make sure we're following all these guidelines and they're not returning until the time is appropriate. Now, I know you're not over our custodial staff or our operations staff, but we also have a question that folks are asking about, do we have any plan or protocol for cleaning our school buildings or even a section of the building if a student or staff member tests positive for COVID-19? What are you able to share about that?
Well, we certainly do have a specific protocol. I know that Dr. Duas has worked with our custodial staff to identify that when we have a positive or affirmative case, that will be a comprehensive cleaning protocol with the same products that we're using daily. And those are products that are supported by CDC guidance in managing COVID as a pandemic. But that comprehensive cleaning will look different on days that or if there were to be a day that there had been a positive finding. We're going to be providing that comprehensive sanitizing and disinfecting to all surfaces, floors, learning materials, and ensuring that any area that the student may have participated in activities would also kind of have that comprehensive cleaning, not just their classroom area.
Well, Beth, I'd like to thank you for joining me today on this broadcast. And for those that have tuned in, just another reminder that all the questions that I asked Beth and the answers that she provided, we've also captured in our frequently asked questions section of our Return to School section of our webpage at Bedford County Public Schools. So please check that out. Also, if you have any questions as we start the school year, please be in contact with the school nurse at your child's school or with the principal or with the teacher. We really want you to ask questions and understand our processes about whether it relates to your child or just how we're handling positive cases. So again, We look forward to the start of school on September 8th, 9th, or 10th, and please stay safe.